All right, here we are. We want to welcome everybody into another day here on coronavirus inside the Arizona numbers, where Garrett and I break down and get a closer look at some of the numbers that are coming out of Arizona specifically. We want to thank all of you for joining us on here. And as always, if you have any comments or questions about where to find this data for yourself so that you can make the best choice for your family and your life, we're happy to help you do that. As I just mentioned, I'm Katie Rammel. Alongside me here, Garrett Archer, our data guru. So lucky to have him to help us better understand the numbers. So Garrett, once again, thank you for taking time out of your busy day to chat with us. Let's see. We always start on the summary page. I know we have a ton to talk about today. I do want to mention to everybody on here, the governor's speaking at 3 p.m. So we're about an hour and 10 minutes out from that. We'll be covering it live right here on Facebook Live so that you can watch it. It will also be over the air on ABC 15 and on all your streaming devices. So wanted to get that in there right away. Let us know where you're watching from as well. If you're watching from here in Arizona specifically or somewhere else across the country. And Garrett, let's start right there on that summary page. A lot to talk about there.
Absolutely. So yes, AZDHS summary page, 170,000, almost 171,000 COVID cases confirmed in the state. The number of deaths, 3626. The number of new cases reported today was 2525, and that is off of about 14,000 cases, 13,867. But the number, of course, today that is the focus is the record number of deaths reported. That's 172 deaths that were reported, and there are some notes that come with that number. The first note is that, of course, these never occur in a 24-hour period. These death numbers are always over the course of time. Anywhere from, in some cases, 21 days, 7 days, 14 days, and sometimes even farther. The AZDHS did inform us that there was death certificate matching going on this count. 78 of these deaths, I believe it was, were from death certificate matches. Now, what that means is, just so everyone knows, is it's basically they go through and they basically query the hospital systems for death certificates that they may have missed. Or were subsequently coded as COVID-19 to pick them up. And what we're seeing with these death certificate matches, because they've been doing a lot more of them lately, is that they are mostly picking up deaths that are occurring more recently. So when they first did this sort of several months ago, these death certificate matches would pick up all over the place. They'd go as far back as March. And now we're seeing really the vast majority of them are coming in and staying in within sort of a 14 to 20 day period and sort of loading where we should expect these to be loading at. All right.
So 172 is a record by a long shot, or how far out were we from that? And then how do those days look as far as our peak day? Did that move our peak day of death here?
It did. Our most recent record was on July 18th. At 147. We did on July 25th report 144 deaths. So we have had a couple triple-digit days here in the last since the middle of July. And as far as what it's done to the curve itself, I'll take you to the COVID-19 deaths. You can see that now there are 2 peak deaths. These are the actual date of occurrence. So when people ask, this is when the certificates, this is what the date has on the certificate. And you can see a new peak death date is now on July 15th. So we have 2 of them, one on July 7th at 80 deaths, and now one on July 15th at 80 deaths.
So once again, for everybody who's just joining, just because that high number was reported today, the highest number we've seen, again, that does not necessarily mean, or really ever that we've seen it in that case, that it's meant the last 24 hours. Those dates are specifically plugged in on the chart there, and that does change our peak today. Garrett, thank you. What other information on this page did you see that was of note today?
Pardon me. Well, we did have, let's see, when we go back to the summary page, we did have 11,000, so almost 12,000 PCR tests. And when you compare that with the numbers that Sonora Quest has released today, it's that we are getting through the backlog. And we were sort of all expecting, because we were used to seeing large numbers when Sonora Quest was processing, was having difficulty processing all of these. And so we were sort of expecting, oh, we're going to see 30,000, 40,000 test days, and that hasn't happened yet. But what we are seeing is that one of 2 things is happening. A lot of, and we've seen this, Embry, I think it's Embry Women's Health, and some other like places that are doing large testing batches are moving away from Quest Labs and moving to other laboratories that can report faster, because we're not seeing these high PCR numbers, but the Quest backlog is being filled, or is being completed. They have about 26,000 in the till right now. So we're seeing them actually. I don't know if they're going to make their July 31st deadline, but they're going to get close.
So 20,000 still in there. Yeah, if they ran the 10,000 extra tomorrow or 15,000 extra, they'd be pretty close to that at least by the weekend. Or we could say that we might have complete reporting by Saturday morning.
Yeah, we could technically have it by Saturday morning. I mean, depending on the speed we've been showing this at, it's more likely probably Monday or Tuesday, just because of the weekend lag. But we could be up to date with Sonora Quest. There will always be something pending in Sonora Quest, but
right.
Those numbers should be anywhere from 400 to 1,500 tests pending, but certainly not 26,000. So we should be through them by hopefully early next week.
So for folks who don't join us on here every day, there was a backlog of cases over at Sonora Quest, which is our largest provider of results and running those results. So we saw a backlog of about 62,000 at its height. And Garrett, you're saying now it's down to about 20,000.
Yeah, it's 26,000. It's in the mid-20s, but yes. And I did see one comment saying that these tests are two, that people are taking two tests and being counted as two people, and that's just simply not the case. We've had this verified several times by both the county and the state health departments independently, and people are not tested. Or if they are tested twice, which is absolutely a possibility, they are not counted as a case twice. It is a simple measure of billing. When you get a medical bill, you don't get two medical bills, and so you are counted just once, and that is how it works. Maricopa County Health Department went on record yesterday saying the same thing. So we've gotten this verified several times.
Yeah, Angel writes, if one person who gets tested 5 times is going to count as five tests. Not the case at all. You could have 5 tests on your chart, but yes. Angel, your chart is going to be specific to your name with your date of birth. So that's how they're tracking you. When you sign up to take a test, I took one recently, as I mentioned, it's going to ask you for a phone number. That is not based on your phone number. You do have to put that in, but this is attached to your specific name, your spelling, and your date of birth. So that's how they log all those together and make sure that, just as Garrett was saying, that it's a separate record. Yeah. Let's see. Some of the other things we want to highlight. One thing of note, worldwide, we have passed 17 million cases of coronavirus just today. So 17 million cases worldwide, 4.5 million here in the US. And then, as we just highlighted on this sheet here, 170,000 cases in Arizona. Let's get to some of the numbers that we have been hearing that might be used as metrics in all of this, and talking about some of these downward trends in cases. We do not have any specific metrics from the state on how they will reopen schools just yet. That's something that might come at 3 o'clock. It's something that has been long awaited. And then, of course, each school district will decide for themselves. The White House has put out some gating criteria, but educators here in Arizona have said that some doctors and teachers and school board members have come together, and based on that White House criteria, they sort of came up with their own suggestions in this. And one of them is downward cases for 28 days. So we can't look at the day to day, Garrett, because it fluctuates too much, and that would put us back at 0 quite often. But how does the overall curve look? Are we getting closer to their suggested 28-day guideline?
No, not at this very moment. As you can see, I've got this on a 7-day average. This is just cases on a 7-day average. Mm-hmm. And what we're seeing is right now, there was a slight increase in the average for these last couple days. We were doing really well, as you can see right here in this curve, from July 15th to about July 24th. But right now, July 28th to the 30th, we have gone up a little bit in the case numbers. So our gating day, technically by this metric, is at 0 at this very moment.
Okay, so it's one of the things that we'll watch within his news conference there today. And of course, the other suggested number from this group is below 5% of a positive test rate. And we're nowhere near that. I saw on your Twitter today, you broke that down 3 separate ways. When you're just relating it to the PCR test, when you're relating it overall, I think the lowest we got in any of those categories based on your assessment was about 14%. So we'd be a long way from 5.
Yeah. So that's a very good point. Because of the way that the AZDHS is compiling the data in the dashboard, we have to make some certain assumptions about the percent positive. So what we do is we do break it down 3 ways. I'm looking for the exact numbers, and then I will.
As you're pulling that up, Garrett, Judith asks, where are you getting your data? So I'll answer that as you're pulling up that graph. Judith, we get our data directly from the state. So I know that you're probably hearing a lot of conversation online about it going other places, going to the CDC or the White House or somewhere else controlling that. We're getting it straight from the state. So it doesn't matter where they then go with the numbers. We're getting it long before that conversation ever starts. So while that may be concerning to some in and of itself, that's separate. We get our numbers right from the state, right here from the source, right from the hospitals. So I want to answer that quickly, Garrett.
So on percent positives, this is something to note. I'm going to pull up it's my Twitter account, so please excuse like maybe some of the comments or something. But if you look at this, you can see that I calculate it 3 ways. So the cases to PCR tests, that was 21.3%. However, that is the highest estimate simply because the state adds in antibody tests to the totals. So we know that this is a higher than what it should be percentage. So we also do cases to all tests. So this would be including all the antibody tests and the PCR tests and just putting it all together, and that's at 18.2%. And then on the third one, we actually do an estimate. We try to pull out those antibody tests and see what the actual diagnostic number is. We have a floor of that. That floor is whatever the cumulative test is, and we've been under 14.6% on these diagnostic tests for some time now. Unfortunately, that's sort of the problem with this calculation, is it will always floor to the cumulative number. So it's somewhere below 14.6%.
So when we see these 3 separate ways to calculate that here, and we don't know how the state is going to suggest that that's done, or if this is even part of the metrics in that, but this is the closest number we have at this point.
I can tell you that what the state is going to use when they do the percent positives, and I'm going to take this off and go back to the AZDHS website, because this is going to be when they do their metrics, the closest they're going to get is this laboratory testing, and right down here in this bottom, this is the best PCR percent positive we have for Arizona right now. This is basically every week, the number of tests that were conducted that week and the number of percent positives from that week. The number is still a little high because there are laboratories that don't report negatives, but this is the best one we have. So you can see our peak was on June 28th at a 21% positive, 19% on July 5th that week, 16% on July 12th, and here we're at 12% right now on the week of July 19th. This one right here is at 11%, encouraging, but there's only 11,000 tests in there right now. That has to be filled in a little bit more before that number, that 11%, will stabilize. So we're just going to keep watching this July 26th number and see what happens. It's just too early to say that this is going to be 11%. It may be lower, it may be higher.
So for a frame of reference, it was back at the end of our stay-at-home orders for Arizona at the end of May that we saw that we almost got to 5% in that particular metric.
Yes, we were right here in the middle of May. We were at just 5%, right here at the May 17th, which is around the weekend that he opened the state. The governor opened the state. We were at a 6% off of 35,000 tests. So just want to see as a comparative, we're at 12% right now, so roughly double with 43,000 tests. So nearly the same amount of tests with a double percent positive right now.
Interesting. And the other thing to track would be how long do we need to then stay at that low percentage? How long do we need to hold there before we know it's legit? And then how far off that 5% would that trigger whatever to happen, pull that number back down.
And the governor and the AZDHS will likely argue that as opposed to the reported percent positives, they're going to rely more on this curve. And it's going to be one of those things where it takes 2 weeks for this thing to fill in. So, they're going to look at this and say, look at this, and they will likely aggregate it by week as well, just like what we're looking at. We tend to, because we're doing this every day, we tend to analyze everything on a daily basis. They're going to look at this by week, and I don't necessarily disagree with that methodology. Like I said, this is probably, because it's done by week, it's probably the truest and best percent positives we have, because there's such large numbers we're looking at. So I don't necessarily disagree with that, but the disadvantage of that, of course, is that because you're doing it by week, you have to wait for the data to fill in. So it could take 2 or 3 weeks for them to have enough data to declare that the curve started here and this is where we are now.
Right. A couple of comments I want to get to. Lorenzo saying that my sound transmission is much improved. Lorenzo, that's because I'm here at home today. Thank you for that. Most of these I do hear from home, and then if I need to go over to the station, I do. But as on Wednesdays, I apologize for the sound being a little off. I'm in the station, and since no one's in there, it can be kind of echoey. So thanks for noticing, and I'm glad it's better today. I think I'm going to bring a mic next Wednesday, so I'll probably have earbuds in. Debbie's asking, Garrett, can we estimate how many total tests the labs that don't report negatives process? So you have a chart that kind of shows negative, and is it far off base to say that most labs are reporting the negatives? I called
absolutely. So Quest Labs still makes up about 80% of the PCRs, right. And they are they make up 80%, and they do report negatives. And also ASU, which is likely going to become it's growing. The saliva test is growing as a share of PCR tests, and they also report negatives. They're on the electronic reporting system. So I'm going to stop screen here and share with you this graph that does sort of analyze that. So this is right here, and this is basically this light blue. It's a little hard to see. I wish I could bring it in a little closer. I'm sorry. This light blue, or this dark blue, is the PCRs that do report negative. This tan number are the antibodies, and this dark gray are the PCRs that don't report negatives. As you can see, ever since sort of ASU began reporting this, and Quest Labs fell into a backlog, we're now in a situation where these negatives are they're less and less of a share. These PCRs that don't report negatives are becoming less and less a share of the curve. Right now, 26,246 tests or cases in total came from PCRs or labs that didn't report negatives. And antibodies, it's about 11,300 cases. And then the remainder, 133,000 cases, come from the labs that do report negatives.
So comment coming in, Tamara says, when at least 2 million in AZ are tested, then we can see more accurate percentages of infected. AZ needs more testing. So to Tamara's point, which is a really good point, obviously more testing is more accuracy. We're getting more numbers so we can better judge what's going on. The most accurate look at numbers would be to test every single person every single day, and we'd have a very clear picture of how this looks. That's not possible, obviously. So this is the best we can do at this point. But Tamara's right. The more tests we have, the better we could see things. At this point, for everybody, we're at 1.1 million test results in, tests taken and results in here in Arizona. More than 1.1 million. If you'd like to get a test, sign up. This is not a case where you have to be showing symptoms anymore. This is if you're curious, if you want to get a test, if you need to get an elective surgery done, they're going to require you go do this. So this is not people with symptoms necessarily 100% showing up there. It's anybody who is sent there by their doctor or anybody that's just curious. To sign up for that, go to the Arizona Department of Health site and click on the COVID section, and the sign up is right there. They have both the saliva test that Garrett just mentioned and the nasal test, the diagnostic test, every way to sign up for that stuff. It's so easy to do. And as I mentioned, I went last week for the saliva test, and you're in and out of there in 20 minutes. So it's drive through, super quick, felt very safe in there. Let's see. Sarah's asking, why are they asking for insurance for the test? The tests I spoke of with ASU are free tests. They will not ask for your insurance. Sarah, they will ask for your cell phone number. That was the only tough thing in signing up for that, because if you are over 8 years old, you're allowed to sign up, but most 8-year-olds I know don't have cell phone numbers linked to them. So you've got to figure that part of the test out. But that was the only That was the only hang up in the sign up process that we saw there. So go get tested. Let's see. What if you want an antibody test? I don't know. Is the sign up there on that page as well? I was trying to remember if it's on the AZDHS site. Most of the antibody tests are an actual blood draw. So you've got to likely sign up for that through your doctor or through a medical office or through SonoraQuest.
Yes, I've actually not seen, I'm not looking and tracking where the testing locations are. So yeah, I wouldn't know where, the difference between where to get an antibody test.
Yeah, so Scott, I would call your doctor for that or SonoraQuest for that. Those are the two places. But as far as diagnostic tests, not the serology test. The serology test is the antibody test to see if you've ever had the antibodies in your system. That is separate. That is what people are still paying for. This is the test to find out if you are carrying a COVID carrier right now. Okay, so many questions coming in. I want to get to so many of them. Just to stress again, the governor is going to speak at 3 o'clock. So we're coming up on that in about 45 minutes. We'll wrap up before that happens. You can watch it right here and also on ABC 15 on the air and everywhere online on all our social brands as well. Garrett, let's talk about the R0 number. We're still at 0.91. I think I checked it today. It was at that. We were not the farthest over on the list anymore. I saw both Vermont and Texas sort of leapfrogged us. But how does that range look? So we talk about the number so often that is stamped for us for that particular day. But the range is important in watching because this is just a estimate of where we are. So how high is the top of the range and how low is the bottom?
So yes, I've shared the screen. We are at, as you said, 0.91 is the R0, but the range is anywhere from 0.72 to 1.12. So we are still in a situation in which the best, most confident guess is that our R0 can still be over 1. And that's sort of where we are on this. And I do say this almost every time. These numbers are recalculated every single day. So as you can see, 0.91 yesterday. I know it was 0.90 when we reported this yesterday, but now yesterday is showing up as a 0.91. And it said this is calculated every single day. So this is an estimate. That's why the error bars are so important because of that.
John asks, when did news anchors become health experts? John, we are absolutely not health experts. What Garrett is a data analyst. He has a long history of experience with this. We're just applying it to the COVID numbers. So we will not comment on particular health responses to this and cures to this. We're only here to show you the numbers and direct you to some of the ways that they're saying to get tested and things like that. We are not health experts for sure. Brittany writes, Vitalant and Red Cross do free antibody testing when you donate blood. Brittany, thank you for bringing that up. That is so true. You can donate at either place. They've got an easy sign up online, both of their websites, easy to find. They do the free antibody tests. When you donate blood, it does take about 2 to 3 weeks to get that information back. But Brittany, thank you for bringing that up. I'm so glad you did. That's a way to get those numbers for free. And then Ray Allen writes, and then I want to get to hospitals here, Garrett, the hospitalization numbers. Ray Allen asks, why can't we get the rapid response test that is offered to top government officials? That ASU test, Ray, is rapid. You'll get that within about 48 hours. So that's the test that they're using. You're seeing them use it like MLB and the NFL where they're able to test really quick. That's exactly that. So sign up for the ASU one. If you're watching from Tucson, you can sign up. I believe the ASU one, they're doing it at the Ellie Town Center in Tucson, and up here for the ASU test is over at the stadium. So you can sign up for that. It is free and it is as close to rapid as you'll get. Brant's writing, thanks, Katie and Garrett. You give out good information. Brant, thank you for saying so. That's why we hop on here each day, help people find the information and the numbers that are coming out. Okay, mixed bag in hospitals today, I think, Garrett. Oh, and is Garrett frozen? I think Garrett's shop might be frozen.
Sorry, my computer decided to freeze. So I had.
Okay. As I always say, I'm at home today, so I thought maybe the kids jumped on Wi-Fi when they're not allowed right now. Okay, so we were talking about the hospitalization numbers, and I thought it looked like kind of a mixed bag today.
Yes, for the most part, everything is still going down. Let's start with the census numbers. But there have been some increases in some places. Nothing sort of alarming quite yet, just things to watch. Here we are, I've got this sharing. The general hospitalization numbers are agnostic to COVID-19. You can see that the ICU beds did increase a tiny bit. Emergency room beds also increased a tiny bit. Inpatient, there was also an increase for inpatient, which is the general acute care beds, just basically anything that's not an ICU and a maternity bed. So we did have increases essentially throughout the hospitals. But let's go and focus on the COVID-19 specific metrics. We can see the general acute care beds, the standard inpatient care beds. We're still seeing a continued trend downward in this metric. Our peak was on the 13th of July at 3517. We are now over 1,000 under that and continuing to go down. Ventilators also coming down. ICU beds also coming down. Discharge numbers basically similar to what it was yesterday. And this is the one that sort of, that I don't want to say causes concern, but I'm watching probably the closest right now. Is there's now a 2-day increase in the hospitals, in the emergency room visits for COVID-19 patients. That one is somewhat concerning. It's going to be something to have to watch over the next couple days, because we found that sort of emergency room metrics seem to be a really good leading indicator of what's going to happen in the hospitals as people are coming in because they're exhibiting symptoms. So we're going to be watching this over the next couple of days and see what happens. Hopefully it will start reversing itself and this was just a momentary blip up. But you know, we just don't know yet. You know, that's the whole thing about this, is we have to continue to watch. And intubations, which is obviously related to ventilators, has gone down as well.
Garrett, one of the questions that's coming up as you're sharing this is, are these numbers lagging? The hospital numbers lag by how much?
These do not lag. These are reported. These are bed counts that were from yesterday. There can be instances in which some of these numbers may be, you know, there might be some sort of mixing and report for 24, 48 hours. But for the most part, these numbers are, all of these census numbers that we're looking at here, as well as these, are all reported directly from the hospital systems. They don't go through the hands of AZDHS. They don't go through the hands of Health and Human Services. These are numbers that basically they pass on, and the AZDHS simply puts them all together and then pushes them up.
So it's our sort of best real-time indicator at this point. Yeah, Mary Kay's asking, are those hospital numbers current or delayed like the test numbers?
Yeah, they are not delayed.
Yeah, the only delay that we're seeing right now is those test result numbers, and we'll continue to track that. Tomorrow will be a telling day whether we're able to kind of get things caught up in some of those numbers as well. All right, for people who are just hopping on, once again, the governor is about to speak at 3 o'clock. We're about 40 minutes away. We don't have any indication about the topics he'll highlight, except we do expect that education will be part of that. We just don't know at this point, maybe giving some sort of framework for schools. School districts here in Arizona are on their own to figure out what their metrics will be to bring kids back into the classroom. A few more classrooms today saying they'll wait till October. A few more school districts, I should say, are saying they'll wait till October. If you want to see what the school district for your kids or your grandkids or even just in your neighborhood is doing, you can find a section on abc15.com/schools. It's got an interactive map for you right there. You can hover over the school district that you're interested in. It will say either their plans, their set plans, or their proposed plans for students to come back safely into the classroom and at what point they might be able to get back into the classroom. All right.
I did see a question from Valerie Ramirez regarding the ER numbers and if they are COVID probable or COVID positive. And what we have been told by AZDHS here is that this is a determination by the hospital systems. That number is not necessarily always going to be someone who tested positive for COVID and was someone who's in the case data. This can be someone who attributed symptoms that were very COVID-like, and they are basically determining that that was a COVID-19 hospital visit.
All right, thank you for clearing that up. Let's see, what other numbers have we not talked about here today? Let's see. What's the?
I can bring up the Sonora Quest numbers just so
yeah.
everyone can see that.
Audrey's asking right now, what's the amount of tests that are still lagging, so we can kind of take a peek at that. Audrey, we're making progress. We're not there yet. They said July 31st was a deadline. That's tomorrow. Hopefully they'll make it there. Garrett, they were saying they were installing some new machines that would process up to 37,000 tests a day. If they're getting those in, that would help to get through this backlog in no time. But we'll see. Today's test results that came in, just about 14,000 test results. Those are from all the labs, not just SonoraQuest. But how does SonoraQuest's sheet look today?
SonoraQuest has, I know it's hard to see a little bit, but their pending number is 26,717 tests. So that is what our backlog looks like. That started out at about 65,000. It looks like, in fact, they removed, I didn't even notice this before, they actually removed the moving average of the positivity rate entirely on this dashboard now. So they won't even tell us what they won't give us any indication of what the positivity of the tests that they're sending over to AZDHS is. This has been changed twice now in the last two dashboards. They used to give a daily positivity, then they moved it to a moving average, and now they've removed it. So we have to go look down here at their epi curve, their testing epi curve, to see what we have. And you can see their testing epi curve largely mirrors what we see on the AZDHS. We see on July 5th, 23.44 Quest Labs test came in positive, 19.8 for 7/12, and right now for the 7/19 week, we're looking at 15.27% positive.
All right, we will keep tracking that. The reason this is so important to us is because once we get through this backlog, it's going to give us some better indicators of the numbers that we can really trust, the numbers that have stabilized, because some of the numbers became a little less trustworthy when we had 60,000 cases kind of hanging, or 60,000 tests kind of hanging out there waiting to be
that has, I mean, we talk about the R0 number every single day, and that number is dependent upon how AZDHS is reporting the numbers. And if cases are going back 15 days, that sort of washes out the case numbers farther than it should, and so it sort of makes it changes the R0 estimate. As we get closer to filling this backlog, we can sort of be a little bit more confident on that R0 estimate, and it looks like we're almost through. And as we've seen, as we process these 65,000 tests, we're down to 45,000 with Quest Lab. The R0 has not significantly changed that much, so that sort of gives us confidence that when they're done processing all of these, that will likely still be in that 0.9, 0.91 range when they're done.
Mm-hmm. Terry writes, guess the masks aren't working. From the numbers in our state, Terry, they absolutely are. Once the mask mandate went into place in Maricopa County, at least, the numbers started trending down and have been trending down since then. So it looks like they absolutely are working here in Arizona. Let's see. Why, Anicia writes, why are the churches opening when the numbers are still high and it's not safe? I believe that the churches were always able to stay open. They did not close the churches. The churches were allowed to, or allowed. Many churches chose to take their services online instead of putting people in danger by having large groups together. So that's the latest information that we have on that.
Yes.
Okay, Janice writes, what's the R0 number, Janice? We went over it just a minute ago, but I'll mention it to you. It's 0.91 here in Arizona. It seemed like a lot more states were getting in the green there, Garrett.
Yeah, let me pull back up again. But yes, it seems that we are seeing more states in the green. Let's see who's joined us. We used to be the best. Our estimate was the best in the country yesterday. We're now the third best. So. Let's see, what do we got? I'll just pull it back up again just to show so we can see the green. I'm also going to darken my screen so it's a little easier for people to make the difference here. So we have, let's see, Washington, Florida, New York, California, Louisiana, Delaware, Wisconsin, Georgia, New Jersey, Utah, Michigan, North Carolina, Nevada, Oregon, South Carolina, Ohio, Maine, us in Arizona, Texas, and Vermont. So that's the green states at this point. That is much bigger than it has been.
Yeah, that's for sure. Let's see if you have any questions about where to find specific information. We're happy to help you do that. We're going to have to wrap things up in about 15 minutes, 10 minutes here, because we'll have to hand it over to the next group and as they get ready for the governor to speak. Andrea writes, what's the criteria for being in the green? Andrea, really good question. It's below 1. So anybody above 1 is going to be in the red, and green is going to be below 1. Of course, that whole bar, that's the range where we could be. but the likelihood of the number that is up on there is what, 95%. We're 95% sure.
Yeah, the confidence intervals and things like that are about 95%. Yeah.
Yeah. So that's the criteria, Andrea. We see that bounce around a lot. And one other thing I should stress, this is not related to the deaths or hospitalizations or anything like that. That is simply a number that is related to cases. So for lack of a better way to say it, they don't care what the outcome is for that number. This number only cares about the case numbers coming in. So that's why we're so anxious for the Sonora Quest to process those other results so we can get a little bit more sure of that number, that R0 number that's being provided from that. Where's the chart found, Sandy asks. I think, Sandy, you're asking for that R0. We generally use rt.live. The address is rt.live. That's the chart it's so easy to read on that site. That's why we use it so much. Garrett, talk about how there are different ways to calculate that number, if you will. There's different places that are coming up with that number just slightly off.
Yeah, and that because there's probabilistic formulas involved with rt.live with doing the R0 number. You basically it's like you stay within a certain formula to do the R0, but there's a little bit of flexibility on how the methodologies can be calculated based on forecasting and modeling. So like there are times you'll see a slightly different number. I like to go to one of my favorite projection sites, as I say all the time, is the COVID-19projections.com, and that forecast also does have an R0 on it. And
as you're pulling that up, Garrett, real quickly, Janice is asking, what does R0 mean? Happy to help explain that. The R0 is just a key measure of how fast the virus is growing. So it's the average number of people who become infected by an infectious person. So if it's above 1, they're saying the virus would spread quickly. If it's below 1, the virus is spreading slower. So that's how that.
Yeah. Really so the best way to think about it is 100 people in a group, and 100 people with COVID can spread to 91 people with an R0 of 0.91.
Right.
And so because of that, when you're under that one threshold, then obviously over time, as people recover or die or just there's an outcome to the disease, then there's obviously less people to spread it to. So that's sort of what that R0 is. This is the projection. Sorry, I just want to see, as of this moment, the projections here also have the R0 is in line with the RT Live number right now. Sometimes it differs, but right now it's in line with it.
Let's look at this projections page, and then Brant, I see your question. I want to get to more information in Prescott. We'll get to that in just a second. How do these projections look for? You're on the Arizona page right now.
This is COVID-19 projections USAZ. This is a modeling done by, I said, an MIT graduate student. It's been recognized by the CDC, and it's usually in the top 3 of accuracy of all the forecasting that's done. So as you can see, because deaths lag cases, this now believes that we are we're past our peak in the number of deaths, and that we should start seeing a decrease, gradual decrease in the number of deaths that are reported on a daily basis. Even with today's report not being in consideration quite yet, this still should continue downward. I don't perceive that the curve will shift too far because of today's report. And then we come down here to the actual forecasts, and all these forecasts always go about 90 days out. So you can see newly infected, it believes about 16,000 people are newly infected. Currently infected, it believes about 283,000 people in Arizona are currently active with the virus. So sort of take that 283 and apply the R0 to that number, and that's how you see this downward curve, because those 283,000 people can now, at least as far as this estimate is concerned, not transmit this disease to another 280,000 or more people. They'll be transmitting it to less than 283,000 people. And then the total estimated infections for all people who have had infections, whether active or not, is 1.4 million.
Yeah, that's a lot of people when you consider 7 million are here in Arizona, and that 4.5 million or so are right here in Maricopa County. Let's see. I want to get to these other questions. Crystal, you got a really good question. I'm going to get to you in just a second. Brant is asking about Prescott. Can we? I'm wondering if pulling up a county site is best, or looking at some numbers for him, maybe from zip code map? I'm trying to think what would be the best to get Brant some really good numbers.
Yeah, let me look at the Yavapai County site really quick and see if it's going to work. So yeah, I think we can go with Yavapai County. So I'm going to bring up Yavapai County here. They put out a report around 10 o'clock every single morning on weekdays. And here is this number here. They put all their municipals. Let me bring it in here, and as soon as it shows up on the screen, you'll be able to see it. They have all the municipal data here for case locations. You can see Prescott, 361 cases. Prescott Valley, 363 cases. And this is over time. That is not active. That is over the entire course of the infections or the pandemic. So that's 360. Those numbers are likely not active. All of those. Here is their full estimates: 1719 confirmed cases with 609 recoveries. And then here's their hospitalization estimates. I think it comes out to about 27. And here's the mortality rates. They also have case fatality rates, 3.5% in Yavapai, and 46% of those fatalities are coming from Prescott, which, Prescott is the largest municipality in Yavapai, so that's not unexpected.
So this particular site in this particular county, is this something that Grant and others who are watching from that area would have to go and check each day, or does it have like an email option to sign up so that they can get the info sent to them, or would they just have to, sort of put a bookmark in and go check it out? Or
I believe you do have to go to this site because they can change it. I just gave producer Cortland the URL, so if you want to go to the site, you can go to it. It is yavapai.us/chs. And like I said, they update this site every single weekday morning. And this is also the only site in Arizona that gives us an estimate for minors under the age of 13. No other county gives us that.
And so let's stay right there, because that leads us right into Crystal's question that I wanted to get back to. She was asking about some of the numbers under 20. So before we go to look at maybe Arizona numbers, let's see how it looks just out of curiosity for Yavapai County, and then move into. And here's her question: is it concerning that 20 and under has surpassed the 65 age group and almost at 45 to 64? Okay, let's get into some of those numbers.
So in Yavapai County, as you can see, their case count for under 12 is very low. It's only 67 out of 1719. That's less than 1% for Yavapai. And let's see, do they have case fatality? They don't even. I mean, they bring their case fatality rate to all the way, because there's been only one death under 55. That's how far forward they bring the age for their deaths. So obviously, very low, very, very low death numbers for Yavapai. No one under, likely no one in that age, but we just don't know because they only give us 0 to 54. We don't know how old that person was, but there's only been one.
Right.
Go ahead.
I was just going to say, so to get to Crystal's question overall and looking at Arizona, we were at about 20,000 cases of people under the age of 20 with a COVID diagnosis yesterday. Is that about the same?
Yeah, we're at 20,190 for less than 20 years old. And they are of the demographic groups, and I'll go there right now. I'll take this Yavapai screen out and go back to the demographics on the AZDHS.gov. And that has been the highest, it's the fastest growing demographic right now. It's still not growing at a much faster clip. It's about 0.4 points faster than the other demographics. But like, for example, today, that age group grew by 2%, and the others, the next fastest was 1.6%. So, and we saw this in the very beginning of the pandemic. At the very beginning, prior to opening, we saw a higher rate of COVID-19 diagnosis in that less than 20 years. And then once we opened, the category switched, and 20 to 44 started just taking off like a rocket. And we've seen sort of a switch back over the last couple of weeks into where there's more normalized growth in all of the demographics. But because less than 20 is by far the least impacted per capita demographic in Arizona, there is more room for that demographic to be just simply, there's more case growth room there. So we have seen it grow a little bit faster than the other demographics.
Thank you for highlighting that. That's something that we want to let all of you know that we can talk about each day for you, because I know so many people are making choices for their kids or their grandkids about schooling, and you're interested in those numbers. So we're happy to help you find them.
I see Sandy Bartlett has asked a question.
Yeah, I saw that too. Let's answer that.
Hi, Sandy. Yeah. So Sandy, I'm going to bring up let me just bring up my application window here, and I'm going to show you how those 172 deaths came out, because this is how it actually happened. The 172 deaths did not occur today. And in fact, anytime you hear a report every morning, the deaths never occur the day before. Not once. It has never happened. All of these deaths always come over a period of time. What I've done here, as you can see, you've got the dark blue was what the curve looked like yesterday, and the light blue was added today. So as you can see, yesterday there were a number of deaths added, but deaths were added all the way back to it looks like the early July in today's report. So pretty much from all the way over here, there's been deaths added for this entirety of July, and that's where those 172 deaths come from. They certainly don't come from just yesterday or even the last couple days. It's spread over a pretty large area.
Yeah, so whether you remember showing up, Sandy, as 1 or 172, this chart will help show the dates that they're actually filled in on.
Yeah, and this is sort of a weakness in this curve. As you can see, this yellow line, I've got this set to a lag of 10 days. And as you can see, sometimes that lag fails because this is a very unnatural drop right now. That drop is likely not going to hold over time. We still could be seeing, and I said, I already perceive that we're going to be in a lower number of deaths here. We're going to start seeing a decrease in this, but it's probably not going to be this fast. These numbers will probably fill in a little bit, and we'll probably see sort of a trajectory closer to this on our death rather than a complete drop off the cliff like this.
Yeah, no matter what, we hope the deaths slow. There's so many families, as we talk about these numbers, that are real families and real lives behind it, and memories and legacies lost there. So we pause to think of all those people here in Arizona who are suffering the greatest loss, where we can all talk about the numbers and talk about what's going on all day, but until you live it and experience it, there's nothing like it. So we have 3,600 families, more than 3,600 families here in Arizona experiencing this loss of a loved one, and across the U.S., 152,000 families mourning the loss of a loved one. All right, we had a mixed day today. So the hospital numbers were up and down. The death number, of course, very high. We just highlighted that, and we're waiting to hear from the governor. That should be coming up in just about 15 to 20 minutes. I want to let you all know that will be broadcast right here. So if you're watching on Facebook or you're watching us on YouTube right now, that information will be broadcast right here. Of course, you can also watch the governor on air coming up at 3 o'clock, and then any of our social media channels as well here at ABC 15. And if you can't make any of that, maybe you're working from home at your desk right now and just cheating a few minutes away, and you got to get back to work and you won't be able to watch, don't worry. We will have a full recap coming up on ABC 15 News at 4, 5, 6, and 10 p.m. And as always, if the governor puts out any new executive orders, I will have word by word, line by line, that executive order posted for you on my Facebook page. You can find that on facebook.com/newsfromkatie. You can also catch up with me on Twitter, and that is twitter.com. My handle is @KatieRammel. Garrett's Twitter account is @Garrett_Archer, a great place to check between 8:30 and 9 in the morning when he puts those numbers together for us and we have a better look at things. Dorothy's writing, thank you for the numbers. Dorothy, thank you for joining us. This is why we do this every day, not to make decisions for your family. You are best at that. You know your health and you know your family's particular situation. All we're here to do is to help you walk you through the numbers as they relate to Arizona. So we will see you tonight on our newscast. And remember, the governor's coming up in about 15 minutes.